Hi, everyone, and welcome to One Brooklyn Health's National Diabetes Celebration. Today, we're going to have a special conversation, first featuring Dr. Kurt Kodroff, who is our Chief Quality Officer and Endocrinologist of One Brooklyn Health at Pierre Toussaint. Hello, Dr. Kodroff.
Hello.
And welcome.
Thank you so
How
much.
are you doing today?
Excellent. I'm so glad to be here to raise awareness for diabetes on World Diabetes Day.
Absolutely, and so am I. And it's an honor to have you here, sitting here, and just having this great conversation. So let's get to it, shall we?
Yes.
All right. So let's first talk about the significance of having a diabetes center of excellence such as this in this community.
All right, thank you. I think it really comes down to the rate of diabetes in the community. If you look across the country, the rate of diabetes is about 10%. But in central Brooklyn, the rate is as high as 15%. So in the communities such as East New York, Brownsville, Crown Heights, Bed-Stuy area, the very high rates of diabetes. I think the other component to this is COVID-19. Back in 2020, people living with diabetes were disproportionately affected by COVID-19, more likely to be hospitalized and have poor outcomes. So we knew we had to do something in this area.
Now, I want to talk about the advanced technology that we use here. What are some advanced technology that we use here at Pierre Toussaint to help patients with their care?
It's a great question. I think one of the things that has changed over the last 5 years or so is diabetes technology. And it's really one of the most exciting times for that component of care. And there's two types of technology that I'll mention. One is something called continuous glucose monitoring. These are little devices that you can wear on your arm or your belly, and they actually measure the blood sugar every 5 minutes. This enables people to understand their patterns of blood sugar throughout a 24-hour period. People can learn the effect of different types of meals, the effect of exercise, what's happening overnight, which in the past would be very hard to completely understand. So continuous glucose monitoring is one major advance. Another major advance is the use of something we call closed-loop hybrid insulin pumps.
Say that one more time.
Closed-loop hybrid insulin pumps.
Okay.
These are small devices that continuously give insulin and also are designed so a patient can give themselves a bolus of insulin with a meal.
Wow.
But the real advance over the last few years is that these two technologies now can talk to each other. So someone on a monitor that measures the sugar every 5 minutes, that monitoring can talk to the insulin pump, and the insulin pump can adjust the insulin, especially in a state when you're not eating, to bring the level to a target. So we're very excited about having those technologies and really, where appropriate, using them to help people control their blood sugars.
Wow, thank you so much for shedding some light on that. Technology is rapidly growing, and now that it's rapidly growing for diabetics and those that need that type of support. So thank you so much.
Yes.
Now, you spoke about dieting, exercise. I want to talk a little bit about Ozempic, right? Everybody's talking about this Ozempic scare, and Ozempic is hard to find because so many people are utilizing it for weight loss. And so I don't know, how effective is Ozempic? What is it for? Who should be using it? And are there any side effects that come along with that?
That's a great question. Ozempic is in a class of medications called incretins, which are peptide hormones. And Ozempic is also called semaglutide, and there's other versions of it. There's a medicine called tirzepatide and another one called liraglutide. These are medicines that are usually given under the skin, sort of like insulin, and they have a couple of very important functions. So one function is that when you take these medicines, your pancreas actually releases more insulin in the presence of food. So when we eat, we release insulin from the pancreas. Insulin then helps move the sugar in the diet into our cells, our muscle cells. Sometimes people living with diabetes don't make enough insulin after a meal, that whole process is sort of what we say is blunted. These medicines sort of support the synthesizing insulin and then releasing it in the presence of food. But they do something else that's also interesting, these different medicines, is they actually work in the brain. And in the brain, they tend to turn off appetite. So people feel less hungry, they eat smaller meals, and because of that, they actually start to lose weight. And people can lose quite amount of weight depending upon the dose and which medicine they're taking. But people can easily lose 5, 10, 15, sometimes 20% of their body weight.
Oh, wow.
These peptide hormones probably do something very favorable to fat cells as well. So they work kind of at different places in our bodies, and they have a lot of effects, not just lowering blood sugar, but protecting the kidneys. There's beneficial effects for people living with heart disease, especially heart failure, probably a reduction in stroke. So they have a lot of benefit for people taking these medicines.
Awesome. Wow. So now you spoke about taking Ozempic if they're diabetic and what it does to the body.
Yeah.
But how about those that are not diabetic and that are taking Ozempic? Is it something that is normally prescribed by like a nutritionist or a dietitian or something like that?
It wouldn't be prescribed by a nutritionist. There are versions of these medicines that are marketed for people who specifically for obesity. So there are cases where someone could take that just to lower their body weight. Now, you mentioned about the benefits. There are some side effects to these medicines. So I think talking about medicines like this without talking about side effects would really not be the best thing to do. So most people tolerate these medicines very well, but there are some serious side effects. Rare cases of pancreatitis.
Oh, wow.
Some people get nausea and vomiting, including sometimes in rare cases some very significant vomiting. There's constipation, which tends to be mild, but in rare cases people can have a huge problem with constipation where they actually can't even have a bowel movement. So it's very important that these complications are made known. So I think it's very important that there's a discussion with your healthcare provider.
Absolutely.
So you take all these benefits and weigh it against the risk. The more you are at risk for complications of diabetes, especially heart disease and kidney disease, the benefit becomes much, much greater. For people who may just be a little bit out of shape, need to shed a few pounds, they can achieve an ideal body weight through diet and exercise. I think the risk starts to get close to matching the benefit. And you know, these medicines have really only been around for a few years now in widespread use, so we don't have 30 or 50 years experience like we do with some of the other medicines.
That was some great information. So very informative. And thank you so much for sharing all this information with us. I learned a lot, and I'm sure everybody that's listening today learned a lot as well. So thank you once again for joining us.
Oh, my pleasure. Thanks so much.
Thank you.